Good morning.
Morning.
Thank you for coming to this session. My name is Pamela Pine, and I'm the director of Stop the Silence, which is a department of the Institute on Violence, Abuse, and Trauma. And today I'm going to be speaking about empowering people and communities to combat childhood trauma and substance use. How's the sound? Is it okay or too much? It's okay? Okay. 25 years ago, I was minding my own business, well, as much as I tend to do in any case. And I was sitting at a desk in Washington, D.C., working for an agency that focused on international health development and communication, because that was my background. And I was working with a whole bunch of people who are also overeducated. And I got something across my screen from the Centers for Disease Control and Prevention, CDC. And it was a very, very early call for proposals on interpersonal violence. It was covering everything. It was covering elder abuse and domestic violence and bullying and child abuse. My sister at that time was a therapist out in Santa Cruz, California, and she had gotten a name for herself of being able to successfully work with survivors of child sexual abuse. So I started reading there. And what I read shocked me, went to my heart, really distressed me. And so I kept reading and reading and reading, and I couldn't stop. And what I found out made me wonder why it was that nobody was talking about this issue, or it sure seemed that way 25 years ago. And so I figured somebody needed to do something more about it. And I figured, why not that be me? So I started working up programming and trying to get funding and trying to get support for the issue of child sexual abuse, prevention, treatment, and mitigation. That was a really hard job, but I did very early get funding from the California Endowment, which at that time, and I think still, is a multi-billion-dollar endowment, and they were funding almost everything that came through their doors. And so we started in partnership between my sister's organization, which is Survivors Healing Center and still going in California in Santa Cruz, and my organization, or the organization I was working for in Washington, D.C. And we started a partnership. And it was based on community outreach and education and advocacy and training. And we got a hefty amount of money for a very small nonprofit in Santa Cruz, California. Before I go on and tell you a little bit more about how this all unfolded and what I learned, I'd like to take a moment that's very important to make sure that, given that I'm going to be talking about child sexual abuse and obviously substance use and the relationships between them, that people take care of themselves. That if anything feels uncomfortable or triggering and you just need a little bit of a break, please feel free to walk out, glass of water, put your head down. I'm not going to be offended. Do whatever you need to do for yourself in order to take care of yourself. The objectives of this talk are in 3 parts, and this program, this presentation is in 3 parts. I'm going to speak first about the BASE, Adverse Childhood Experiences, or ACEs, the ACE study and outcomes. And I'm just curious, by a show of hands, how many people in this room think that they have a really good hold on ACEs? Very knowledgeable. How many people think that they have a fairly good idea of ACEs? Okay. So I'm going to go through the ACEs and ACE study, what they are, what the ACE study was and is. And then I'm going to move on to identify the signs and symptoms of childhood trauma related to substance use. And then I'm going to discuss effective strategies for engaging in community-wide conversations, actions regarding trauma and substance use. We will leave a fair amount of time at the end for questions or just overall discussion. So ACEs and the ACE study. Adverse childhood experiences study. Adverse childhood experiences are stressful experiences occurring during childhood that directly impact on a child or affect the family environment in which they live. They include physical, sexual, or emotional abuse, neglect, or household adversity. There are lots of ACEs. Basically, there are 10 that people typically speak about, and they cover all these aspects of emotional, physical, sexual, neglect, etc. The Centers for Disease Control used the definition in a study that started in the 1990s. And more recent work has extended the definition to include neglect, parental bereavement, and children living in care. The potential impacts of ACEs are physiological, neurological, behavioral, psychological, and translate into poor outcomes across a wide range of health domains. The amount of study at this point that has been done on ACEs following up the ACE study, is enormous. And if you Google the ACE study or ACEs or Vincent Felitti or Robert Anda, reams of information and studies will come up. The ACE study was the largest study ever done to determine the long-term adult effects of 10 common categories of adverse experiences. It was done with over 17,000 adults, and it was both retrospective as well as prospective. So it followed them for a long period of time, going back into their childhood and going all the way forward. The ACE study started when Robert Anda and Vincent Felitti, both MDs, had a small group. They were doing a study with a small group under CDC and Kaiser Permanente. And what they found out initially, what they first saw with regard to the ACE study, was that the common denominator among a group of women of obese women was a history of child sexual abuse. And they said, how can that be? They must have gotten the data wrong. And they ran it again and they ran it again and they kept finding the same thing. So they opened up this study to a large data set. I mean, over 17,000 people. That's a lot of people. And what they ended up finding was that there was all these issues that were coming up as a result of childhood trauma. And they continued that study for many years. And they found that the existence of these experiences was found to be quite common, though unrecognized because they're lost in time and further protected by shame, a huge issue. We'll talk about that a little bit later, by secrecy, and by social taboos against routinely exploring certain areas of human experience. The effects a half a century later in adult life are powerful and proportionally related to adult well-being, health risks, mental illness, job performance, social malfunction, suicide, a range of biomedical diseases, including cancer and premature death. And this is where the relationship, the interaction, the interrelatedness of trauma and substance abuse comes in, perhaps obviously so. This presentation and related presentations that I've given over the past 25 years is, for me, as much of a plea as a process of hopefully imparting information to people. It's important to me. I think it's important to our communities. Certainly, it's important to the substance use community. So take a look at this. Adverse childhood experiences have severe psychological and physical outcomes and strongly affect social activities. ACEs, this blew my mind, honestly. ACEs contribute to the top 10 risk factors for death in the US: smoking, severe obesity, physical inactivity, depression, suicide attempt, alcoholism, illicit drug use, etc., etc., etc. And they contribute to an enormous societal and monetary burden on everyone, individuals, families, community, society, and the world, in terms of both the societal impacts, but also on the economies of our communities, our states, our nation, and the world. Billions, tens of billions of dollars are spent on the cleanup of child sexual abuse and other ACEs in educational interventions, on social workers, on judges, on lawyers, on pediatricians, other physicians, on our state mental health system and our national mental health system, our prisons, etc. ACE's effect on the brain and other development is huge, and it starts with this space of adverse childhood experiences, and then we know that it disrupts neurodevelopment. So children are basically almost halted in some respect with regard to what happens to them as a result of these ACEs. Then we go to the next tier, which is social, emotional, cognitive impairment. And so they have trouble growing up and into the world. Then there's the adoption of health risk behaviors, where you come in. And then there are diseases and disability and social problems that occur. And at the very top of the period, we know that it affects early death. This is it's very short little video, and hopefully this is going to work correctly. I believe it will. Just to give you an idea of the ACE study background and what it intended to do and where it's at.